So the question is, what is the definition for mild to severe equine asthma, and how does it relate to the previous terminology of inflammatory airway disease and HEAVS or recurrent airway obstruction? So first, as background, I found that when we were having discussions with clients, it was really difficult to get information across as far as what we meant when we talked about inflammatory airway disease or recurrent airway obstruction. All this terminology seemed to be quite confusing. And when I started to use the term asthma, your horse has asthma, it seems that, the discussion was right away much more enlightening, I guess. Clients definitely gets what, asthma is. And the fact is, we know now that there are a lot of common things between asthma in people and asthma in horses. This really comes from the fact that the knowledge in both human and equine asthma has evolved quite dramatically over the past 10 years. And now that we know that asthma is just not one thing, you have a lot of different forms of asthma, both in people and in horses. And so we really feel strongly that the term asthma as it applied to the horse is appropriate. And so we also make differences between the different forms in the horse as it's made in humans. And for example, the severe form of asthma that we've known in horses for a long time as HEAVS is really what we call severe asthma in the horse. And HEAVS encompasses two main forms, actually. So there's two separate subcategories that's really due to what is triggering the episode of difficulty breathing. So these horses, by definition, you can tell just by looking at them in the stall at rest that they have difficulty breathing. They might be coughing as well. They have nostril flaring. They have really a lot of obvious effort when they are breathing in and out. So that abdominal push, that tucked up of the abdomen, the heavy movement is what is typical in those horses. And then, so the two major triggers is the classic form is these horses, during the winter or early fall when they are essentially indoor most of the time and they're fed hay. We know that's really one of the main trigger is dust and molds that are present inherently in any hay, even good quality hay. So that's kind of the classic form of HEAVS that way back when Fred Derksen and Ed Robinson called recurrent airway obstruction. So again, that was kind of a new term used, that the term recurrent was referring to the fact that those horses can be fine when they are outside on pasture during the summer, but then, again, next winter they are fed hay again, and then they'll have a recurring episode of difficulty breathing. So hence the terminology, and it's due to an obstruction of the airway due to the narrowing of the bronchi of the small air tubes. So that's why the terminology was used. But it's been really known for quite some time. There's also a form of severe, asthma that we see in horses that are actually at pasture, during the summer. So that's more in the southern states, Florida and Louisiana and so forth. And those horses are completely fine during the winter and the fall. However, when grass starts really releasing a lot of, either pollens or molds in May and June typically, so early summer and midsummer, that's where these horses show the exact same signs. You cannot differentiate from a clinical standpoint a horse that's triggered by either the hay in the winter or the pasture in the summer. They look exactly the same from a clinical standpoint. It's just the trigger that's different. And those horses, actually, if you take them indoor in the stall and feed them hay, actually, they would be better than being out on pasture. So essentially, it's the same disease, just the trigger that's different. It's like with human asthma, you might be allergic to, cats exposure, or you might be allergic to actually stable dust, so a different trigger, but the same disease essentially. So that's for the severe asthma. We've known that for quite a long time, and these horses typically, when they trigger, they are kind of mature to older. They at least they are over 7 years of age. That's really the youngest that has been diagnosed with the condition. Most of them are in their teen years. Okay. So the other condition that we see is a mild form of the disease, and what we mean by mild is that those horses may be coughing a little bit. It's intermittent. Some horses actually do not cough, or at least it's not heard, when that might happen. And the main manifestation of the disease might be that they are not performing very well. So you see that more in athletic horses, of course. So in race horses, it's a bit more objectively detected. In sports horses, it may be just horses are not doing as well under the saddle, seem to be a little bit more out of breath, or have a tendency to recover more, over a longer period of time. They're just breathing heavy after exercise, that typically, they would be fine during the recovery. And so these are signs that are, fairly subtle, meaning that, again, you look at the horse in the stall and you do not see any increased breathing effort like you would for a horse with severe asthma. So that makes it a very difficult, disease to diagnose potentially, especially in those horses where you don't have obvious coughing. So the diagnosis has to be confirmed, because there are obviously many causes of decreased performance especially in race horses, but other horses. So you obviously have to make sure you rule out those, lameness and upper airway obstruction and muscle disease, etc. And so that can be done in different ways. Certainly for upper airway obstruction, doing an endoscopy of the upper airway is key to rule out those abnormalities. But if it's not present, horses with mild asthma will tend to have increased mucus secretion. You can see that, especially if you do the endoscopy following exercise. Basically around an hour is best. This is where you are most likely to see the increased accumulation of mucus in the trachea in particular. And there's a scoring system that's been developed by Vince Gerber that allows to quantify the mucus accumulation, a score of 0 to 5. And what we know, for example, in race horses, a score of 2 and above has been associated with decreased performance in both standardbreds and thoroughbred race horses. And a score of 3 and above has been associated with decreased performance in sports horses, so jumpers and dressage horses. So that scoring system has been quite useful. And also by doing the endoscopy, you can also rule out some of the other upper airway condition associated with decreased performance. So that's a valuable test for practitioners in the field, and certainly horse owners should be aware of those options. The other test that is strongly recommended to confirm that these horses have a mild form of asthma is to do a bronchoalveolar lavage. So what this means is a quote-unquote a lung wash, if you will. This is done with the horse under sedation, a mild sedation. And essentially, it entails passing a sterile tube, very long tube. Similarly, as you would pass a tube to go to the stomach to, decompress a horse's stomach, except that here you go into the airway and not towards the stomach. So you go into the trachea and then push it, all the way into the lungs until it can't, advance anymore. And then you wash with a sterile solution and re-aspirate that to collect the cells and the mucus that comes from that. And then by looking at the cells under a microscope after staining, we can determine, whether or not there's a an abnormal proportion of inflammatory cells or not. So that's what we'll call a long wash or a BAL cytology. This is a very useful test because it's very sensitive, and it's in our estimation is better than doing a tracheal wash. So just collecting sample from the trachea, especially for the mild asthmatic horses. And then there are some other, more advanced tests that can be done, but such as lung function tests. So an objective measurement of the degree of breathing effort, for example, of the horse, but that's only can be done at referral centers. So we do it at Purdue, for example, on a regular basis. But the advantage, it can quantify the difficulty breathing. So especially in these horses that seem to have an increased breathing effort at rest, we can measure that effort at rest, give a drug to try to help and reduce that effort, a bronchodilator, for example, to open the airway, and then repeat the measurement so we can confirm for sure that the horse indeed has severe asthma or heaves, and then can essentially quantify how much of an improvement would be expected if it's responding to the bronchodilator. So these are the kind of the main classification between the difference between mild and severe. So it's likely, obviously, there are horses that are quite in between, that are moderate asthmatic horses. Right now, we don't have a good way to quantify that for sure, but certainly we recognize that there are horses that end up quite, in the severe form, but are showing signs, as soon as they exercise, so quite, early, or that are, coughing quite frequently. So these probably would be, called more moderate, asthmatic horses. And so why does it matter to make that differentiation between severe and mild? Obviously, besides just the severity aspect of it, it's because in the severe form, so the heavy horse, we think of it as being affected for life, essentially. They have that allergy to whatever is triggering their episodes. And essentially, if you keep them away from what's triggering, so away from hay, they do fine. They can be completely back to normal. However, as soon as they'll be back, in a stall or even out on pasture, but fed the round bale, for example, that will trigger their signs, within, days to weeks, depending on how severe they are. Whereas the mild asthmatic horses, it's in that most of them, after an initial episode, they will recover, either spontaneously or they are treated. And I would say less than 10% probably may have some recurrent episode. So that's an important distinction, of course, from a prognosis standpoint and management standpoint.